White House press briefing that's expected to touch on a whole bunch of topics like Venezuela, perhaps Greenland. Let's listen in.
And jacked up the healthcare costs of households across the country. This failed approach in our public health system ends today. When these guidelines are followed, Americans will be saving themselves thousands of dollars. If we want to cut healthcare costs in our country, we must become a healthier country. According to the CEA, poor diet is the root cause of obesity, which accounts for $400 billion in medical spending each year. A healthier America will lead to a more affordable America. The new dietary guidelines from the Trump administration will ensure federal dollars go to real food to improve public health and therefore save the American people their hard-earned cash over the course of their lives. So with that, I am going to hand it over to Secretary Kennedy. The great people behind me will give remarks, and then we'll get into Q&A for the officials that are here on this specific topic. They will leave because they're all very busy people, and then I will open it up to Q&A with the rest of you on the rest of the news in the world. So thank you, and we'll start with Secretary Kennedy.
Thank you, Caroline.
Thank you.
Today marks a decisive change in federal nutrition policy made possible by President Trump's leadership and the work of MAHA moms and public health advocates who demanded reform. Today, in accordance with President Trump's directive, Brooke and I will release the dietary guidelines for Americans 2025 to 2030, the most significant reset of federal nutrition policy in history. These guidelines replace corporate-driven assumptions with common-sense goals and gold standard scientific integrity. These new guidelines will revolutionize our nation's food culture and make America healthy again. For decades, Americans have grown sicker while healthcare costs have soared. The reason is clear. The hard truth is that our government has been lying to us to protect corporate profit-taking, telling us that these food-like substances were beneficial to public health. Federal policy promoted and subsidized highly processed foods and refined carbohydrates and turned a blind eye to the disastrous consequences. Today, the lies stop. The new guidelines recognize that whole, nutrient-dense food is the most effective path to better health and lower healthcare costs. Protein and healthy fats are essential and were wrongly discouraged in prior dietary guidelines. We are ending the war on saturated fats. Diets rich in vegetables and fruits reduce disease risk more effectively than many drugs. Whole grains outperform refined carbohydrates. Added sugars, especially sugar-sweetened beverages, drive metabolic disease, and today our government declares war on added sugar. Highly processed foods loaded with additives, added sugar, and excess salt damage health and should be avoided. As Secretary of Health and Human Services, my message is clear: eat real food. Nothing matters more for healthcare outcomes, economic productivity, military readiness, and fiscal stability. The dietary guidelines shape dozens of federal feeding programs, including Head Start. These standards affect 45 million school lunches every day, meals for 1.3 million active duty service members, and food served to 9 million veterans in VA hospitals. Today begins the work of aligning those programs with affordable, whole, nutrient-dense food. Implementation requires coordination across the government. I'm working with many of my fellow cabinet secretaries to deliver results. I want to thank Bobby Mukamala, thank you very much, who is the president of the American Medical Association, for committing to mobilize the medical community on nutrition. And I thank also the American Academy of Pediatrics for partnering on this effort. I also look forward to working with Dr. Jay Bhattacharya and Dr. Marty McCary to fund and prioritize rigorous nutrition research at the NIH and at the FDA. The stakes are measurable and severe. A Johns Hopkins analysis estimates that 48% of every federal taxpayer dollar now goes to health care. The CDC reports that 90% of health care spending treats chronic disease. That means that 40%, 40 cents of every dollar that taxpayers pay in this country is going to treat diseases that could be averted through good food. The United States has the highest obesity and type 2 diabetes rate in the developed world. We spend 3 times more per capita than the European Union on health care, yet our life expectancy is 5 years lower, largely due to diet-related chronic disease. Our childhood obesity rate is 5 times higher than countries like France. 1/3 of U.S. teens have prediabetes, over 35% are overweight or obese, and 20% of young adults have non-alcoholic fatty liver disease. 77% of military-aged Americans are ineligible for military service because of diet-related conditions. If a foreign adversary sought to destroy the health of our children, to cripple our economy, to weaken our national security, there would be no better strategy than to addict us to ultra-processed foods. It's shocking that our own government helped to drive these cataclysmic changes in our diet. The damage is real, it is preventable, and President Trump has ordered it to end. If the United States reduced obesity, type 2 diabetes, heart disease, and Alzheimer's to Japanese levels, we would save approximately $600 billion a year. About 50% of Medicare's projected long-term deficit, or $5,000 per family annually. Current policy worsens the problem. 42 million Americans rely on SNAP, where common purchases include sugary drinks, candy, and chips. 78% of SNAP recipients are enrolled in Medicaid, and 90% of Medicaid spending goes to chronic disease. These incentives raise healthcare costs and undermine health. This must change. The new framework centers on protein and healthy fats, vegetables, fruits, and whole grains. And you can see the food pyramid here. It's upside down, a lot of you will say. But it was actually upside down before, and we just righted it. For the first time, the dietary guidelines directly address ultra-processed foods and set firm sugar limits in federal procurement, driving a significant reduction in added sugar in school meals. I want to thank President Trump for his leadership and the partners committed to ensuring that federal food dollars support real food and better health. Thank you. And I want to introduce my partner and friend, Brooke Rollins, who is an extraordinary collaborator on this.
Thank you. Well, good morning, everyone. Happy New Year. What an honor to be here. I think this is Caroline's first press conference back, and what a great way to start the new year, 2026. I want to thank Secretary Kennedy. Your commitment to the well-being of Americans is such a blessing to this nation. We have been working on these new dietary guidelines really since almost day one. Bobby and I were voted on the same day and sworn in on the same day. So I think the partnership from minute one has been real and extraordinary. As Secretary Kennedy mentioned, America is in the middle of the worst chronic health crisis in our nation's history. Over 40% of the roughly 73 million children in the United States have at least one chronic health condition, and nearly 90% of healthcare spending goes toward treating people with chronic disease. Secretary Kennedy mentioned that, but it is really important to keep underscoring that fact. This crisis is unacceptable. It prevents Americans from living healthy and happy lives. And for decades under both Republicans and Democrats, federal incentives have promoted low-quality, highly processed foods and pharmaceutical interventions instead of prevention. As a result, nutrient-dense whole foods grown by America's farmers and ranchers have been been increasingly displaced. The Trump administration is acutely aware of this danger, and today this announcement is making a major step in doing something about it. Thankfully, the solution is simple and should be non-controversial. Eat real food. This is the main message of the new Dietary Guidelines for Americans 2025 to 2030, which encourage households and schools to prioritize whole, nutrient-dense foods. That means more protein, more dairy, more healthy fats, more whole grains, more fruits and vegetables, whether they are fresh, frozen, canned, or dried. We are finally putting real food back at the center of the American diet. Real food that nourishes the body, restores health, fuels energy, and builds strength. This pivot also leans into the abundant, affordable, and healthy food supply already available from America's incredible farmers and ranchers. By making milk, raising cattle, and growing wholesome fruits, vegetables, and grains, they hold the key to solving our national health crisis. And President Trump is mobilizing government to ensure families across America have greater access to these healthy foods. In the past 12 months, inflation has slowed and wages have risen for the first time in 5 years. Under President Trump's leadership, prices for everyday staples are declining, and more help is on the way. Recent data show that fruits, vegetables, dairy, and proteins, including eggs, pork, and ground beef, are becoming even more affordable every day for our American people. American households enjoy the most affordable and abundant food in the world, and today's release only reinforces that reality. A healthy meal is within reach for all American families. These new dietary guidelines are a framework which is meant to be customized to meet the needs, the preferences, and the financial status of all American families. For example, a meal including such items as pork or eggs or whole milk or cheese, tomatoes, other fresh and frozen fruits and vegetables, whole grain bread, corn tortilla can cost today right around $3 for that meal. $3. And soon USDA will finalize our stocking standards, which means that those businesses in America that take the SNAP benefit, what they are required to stock in order to take that benefit, by the way, that's almost 250,000 retailers across America, that very soon we will be finalizing that rule that will mandate all 250,000 retailers in America double the type of staple foods that they provide for America's SNAP households. This means healthier options will be in reach for all American families, regardless of circumstance, at levels never seen before in our country. These dietary guidelines are foundational to so many USDA programs, and their introduction marks the first step in connecting America's schools and dinner plates to the best of American agriculture. Make no mistake, under President Trump's leadership, we are restoring common sense, we are restoring scientific integrity, and we are restoring accountability to federal food and health policy. The new guidelines are all about putting the well-being of Americans first, exactly where it should have been all along. This is the foundation that will make America healthy again, not just for those of us alive today, but for our children and our children's children and those coming behind. I want to end by saying God bless American families, God bless the American farmer and rancher, and God bless America. What an